All right, here we are again at the Lightning Step Couch at NATAP Conference 2024 in beautiful Denver, Colorado. Sitting next to me today is Michael Johnson, the Senior Managing Director for CARF, an amazing organization that I want to learn so much more about. So, Michael, thank you so much for joining me today.
My pleasure. Thank you.
Tell me about yourself and tell me about CARF.
As you said, I'm the senior managing director for behavioral health with CARF. Um, my role is really kind of being the strategic leader for behavioral health with our accreditation organization. I'm the person who is responsible for the development and implementation of standards for care delivery and business practices in organizations. Um, I'm kind of the interface, if you will, between the marketplace, so payers, regulators, provider organizations, trade associations, and that sort of stuff, and CARF. And we have a fairly significant role, I guess. In the marketplace in trying to ensure quality. I mean, a lot of times people think about CARF as the organization that we do these inspections, and I mean, that's not the language that we use. I mean, we give surveys, like that's what we do, and it's a consultative survey process. Our purpose is to improve quality and to ensure high level services that are being delivered to individuals. And really that's what our purpose is to try to overall in time have organizations get better and better and better. And I think that does happen with organizations that they're not just meeting a floor of regulatory compliance, but rather, they're doing that and then they get accredited and makes them a little bit better. And as they go through multiple cycles of accreditation and multiple surveys, chances are they're going to continue to strengthen, evolve, get better, over time. And they wind up adopting our standards as the mechanism for how they manage and deliver services rather than looking at something external that they have to comply with.
Yeah, absolutely. No, and I think there is a bit of a stigma when it comes to some of these accrediting bodies, but you guys are really doing good things to make sure that facilities are operating the way that they should in the best manner possible. Can you tell me a little bit of the history of CARF? When did you guys start, and what sparked the need for this?
Yeah. So CARF actually was founded in 1966. And it was founded, interestingly enough, the Joint Commission was very instrumental in creating CARF. And even though today in the behavioral health space, organizations often are choosing one or the other in what might be viewed as a competitive thing, but back in the 60s, the Joint Commission was accrediting hospitals and saw that there was community-based services that needed to be accredited, but that they didn't really view as integral to their space at that time. And so they helped to create CARF, in fact, donated space to an organization that became its own not-for-profit organization and all of that. And so CARF at the originally was working in the med rehab space and in the IDDD space. Um, Kind of branched into behavioral health in the early 80s, um, when there was really a lot more emphasis being placed on mental health care and substance use disorder care, really as a healthcare delivery mechanism as opposed to just like a social service.
Yeah.
And so we've been in existence in the behavioral health space, really probably, and it's actually hard to pin down, but it looks like probably since about 83 or 84 is when CARF really got its feet into this particular market.
And what have we seen happen within the industry because of CARF? What benefits overall throughout the behavioral health and addiction treatment industry has CARF been able to improve upon?
Um, I mean, I would love to be able to say like, here's the exact measures, right? I mean, I think that we do collect data that shows that organizations tend to be stronger in a lot of important ways, right? They tend to generate more revenue. They tend to see more individuals that they're providing care to. They tend to increase their reimbursements. And so, those are all important metrics, but our mission is to enhance the lives of persons served in CARF accredited organizations. Really, that is ensuring high quality of services. And so um, it's often hard to measure the presence or absence of quality in an objective way. It's kind of like, how do you know prevention works, right? We kind of know that it does. It may be hard to measure sometimes, but I think that when you talk to people who have worked in accredited organizations and they have experience in figuring out how to implement the standards that we set forth, it forces them to have to think about and intentionally consider how they're going to organize and deliver services, how they're going to measure their performance, and how they're going to measure the outcomes for individuals that are being served. And that CQI process, helps organizations not to just get stuck in conforming with regulatory requirements, but rather, what are this is the success that we're enjoying, and how do we get better over time?
That makes a lot of sense. I appreciate you going into all of that. I think you've pretty much covered everything there. Is there anything that you want our listeners to really understand about CARF? I know you talked a little bit at the beginning that there may be some preconceived ideas. Can you clarify anything that you'd like to? Now is your moment to kind of talk about CARF and the benefits of it here.
Well, I mean, the only thing I guess that I would say is that a lot of times people think about accreditation as if it's this incredibly challenging thing to achieve, and like this is going to be really hard. And it's not that it's not work, right? It would not have value if there wasn't going to be some effort that was put into it for an organization to be able to get to a place where they were demonstrating conformance to the standards. But the standards are not written as if it's the best, the most complicated, the most difficult thing to achieve. The goal is that you can satisfy the bulk of standards and then get better over time, rather than having to get to the best possible thing. I like many organizations are accredited. They aren't all the same, right? They they're going to be differences. There's going to be individual flexibility that's built into the way that standards are written, with the goal of helping you, if you adopt the standards the right way. The purpose is to get better over time, and that's really what our goal is to create a framework, a quality framework for that organization to be able to use it as a way to improve itself
Yeah.
over time.
I like that a lot, and I think that really is what CARF does. I've seen it affect a lot of facilities and seen them improve because they're holding them to these standards, holding themselves to these standards. One last question for you, and then I'll let you get back to your booth and enjoy your day. When it comes to technology, so as you survey, as you go into facilities and are trying to do this, what have you seen that technology can do or cannot do to improve upon these standards?
Well, I think there's an awful lot that technology can do. I think that a lot of times we think about them, and how a lot of organizations approach technology is through the purchase and adoption implementation of an EHR. And although an EHR is critically important, it isn't the only thing that technology is there to do, right? Um, if you're going to measure your performance in a population that you are providing care to, you're going to have to do that through technology. You're not going to be able to have like a piece of paper where you're ticking off answers to questions, where you're looking at perhaps using a standardized instrument or scale to be able to measure performance over time, right?
Yes.
um, I think that I think there is tremendous opportunity that I'm really excited about as we sit here today in 2024 and think about what role does AI have, that it's going to perhaps help clinicians to be able to find the things that maybe, or listen to the things that that clinician might not have listened to in the past, and helping to organize thinking and not miss important items. Um, I think that there's an awful lot of information that gets collected in behavioral health, and it's hard for the clinician to be able um, to organize
Mhm.
information in meaningful ways. So I think that there's real technological opportunity to help us to get much better. And I think that for us, when we walk in, we're kind of agnostic to technology as an organization. We're going to have to adapt our processes to what the organization is doing. But um, we certainly enjoy when an organization has meaningfully implemented, its systems and can demonstrate how it uses information to be able to manage care,
Yeah.
over time.
Makes absolute sense. I know I said that was the last question, but you brought up a good topic that I want to find out a little bit more about from Carf's perspective: artificial intelligence, AI. Do you see that? How is Carf viewing that, or how are you personally viewing that from your position at Carf, eh, being utilized within facilities? Is it something you're concerned about, you're excited about, a little bit of both? Can you talk a little bit about AI, and then I'll let you go.
Yeah, I mean, it's hard to know what the future holds around this, right? I do think that it, in a in a biopsychosocial assessment, for instance, there's an awful lot of information that gets collected, and we've always relied upon the individual training and skill set of a particular clinician to be able to do the analysis of what's the meaning of what was this information that we collected. I think that AI holds promise in helping to identify, hey, here's something that might be meaningful. I think ultimately a clinician is still going to be deciding whether it is or it isn't, but it'll help to put things at the forefront to say, here's the things that look like it might be meaningful, so that you don't miss that. I think that's one of the AI opportunities. I think that sort of some of the technology that's being implemented in behavioral health, where there's kind of passive listening that's going on, in a session,
Mhm.
helping with progress note writing and things like that, connecting to a treatment plan. I think that holds a lot of promise. I think that if a clinician has the opportunity to be able to spend more time directly providing care versus feeling like they're being sort of tied to documentation, can be valuable. But documentation is valuable not just for the purpose of covering your own backsides,
Yes. Yeah.
but really to help to drive and to guide care going forward. So, I'm not a technologist. I'm a clinician by training, so it's hard to know what all is coming. But I do think that um, I I'm excited about
Yeah.
what offerings is going to be there. And I think about when I was providing care, in years
Mhm.
gone by, where I was having to handwrite notes. We've sure come a long way
We sure have.
since those days.
Yeah, absolutely. Well, I really appreciate you taking your time to sit down with us. Again, we've got Michael Johnson here, the senior managing director with CARF. Uh, I love what you guys are doing, and I really appreciate you answering these questions. I think when this gets out, it'll help people understand why you guys are doing what you're doing, and what it is you're trying to do. So I appreciate your time today. Thank you so much.
Thank you.
Yeah,
Appreciate the opportunity.
absolutely. Yeah.